Melissa Toyos. She will be talking something completely different, but then again something quite interesting. And that's how we can do the hair restoration in the eye clinic, from eyebrows, eyelashes, and more.
Showing up. I hope that's not a harbinger for the rest of the talk. I'm Dr. Melissa Toyos, and I'm talking about hair restoration in eye clinic, brows, lashes, and more. I think I know what you're thinking. How in the world does hair restoration relate to an eye clinic? I hope to show you that and more as we get started. I have a few relevant disclosures. The most important one is that I am a speaker, consultant, and trainer for SmartGraft system. That's the system that we use for hair transplantation, lashes, and brows in our clinic. And I thank the committee and the organizers for allowing me to come and talk about some of the work that we've been doing. So my pictures aren't showing up at all. I don't know if I must be operator error. So we all turned into hair restoration experts in the U.S. around the late 1990s with the Xylitol in 1996. We saw our glaucoma patients growing eyelashes that were longer, thicker, and darker. We saw the prostaglandins were able to do that. Of course, Allergan monetized that in 2001 with the advent of Latisse. We know that Latisse and all the prostaglandins actually work on the surface of the eye to increase the eyelash growth, to enhance the growth rate and length of the growth phase, but they also work on eyebrows, and it also works on scalp hair. So we had that information, but we also learned that it causes meibomian gland dysfunction. The prostaglandins themselves will cause dry eye, will cause meibomian gland dysfunction. We've seen that in our glaucoma patients. There are peer-reviewed reports that compare to other glaucoma medications who are more likely to have meibomian gland dysfunction with the prostaglandins alone, and of course many of them do contain BAK, which is detrimental to the ocular surface. Our reader reported that with continuous use of prostaglandins, whether it's for lash growth or for glaucoma, you should expect to see changes, detrimental changes to the structure and the function of the meibomian glands. So not potentially a long-term solution. I don't have any pictures at all, so I'm going to ask you to paint a picture. The picture that I have here is of the doctor's Carruthers. So ophthalmology and aesthetics go way back. I think we have unnecessarily relegated the aesthetic world to many of our plastic surgery colleagues and also to the dermatologists, when in fact ophthalmology has a long and storied history with aesthetics. Not just IPL, the intersection of ocular surface disease and aesthetics, but also with Botox. This was discovered back in 1865 by a Belgian PhD who observed that in some poor deli meat in some of his patients. And then of course we discovered it at Forster Business in 1969. We were one of the first to use it. And then the doctors Carruthers used it in 1992. They wrote their seminal paper on how to use it for wrinkles. Have a great picture here of me with some NFL cheerleaders, the American football, and that's how my pathway into hair restoration began, as I was taking care of these young, healthy 20-year-old patients who were contractually obligated to wear the eyelash extensions. I don't know how popular those are in Europe. They're very popular in the United States. People are putting these nylon eyelashes on their natural lashes with nothing less than super glue. So super glue causing a lot of fumes, irritation, ocular surface disturbance, not only just from the fumes themselves, but often some of the glue will break off with very sharp edges and cause corneal abrasions and issues. But beyond that, the nylon fibers will direct air current onto the surface of the eye and cause ocular surface disease. So we were noticing back in the 90s that these young, healthy patients with no history of ocular surface disease were having ocular surface problems directly related to the eyelashes that they were contractually obligated to wear. And in the off-season, we were doing rehab with Latisse and other products. They were also having the same issues with their scalp because they were using the hair extensions. And they do these really nice hair flips, but it pulls traction on the hair. So we were doing lash rehab, and they asked me, does this also work for the scalp? And lo and behold, it did. Okay, so understanding hair loss, really down to three factors: genetics, aging, and sex. Some of these factors are more modifiable than others, but if it runs in your family, and it's not just the maternal side, it's also on the paternal side. Aging, we know from ocular surface disease that there is something called inflammation. So inflammation related to aging, and of course a lot of these patients, a lot of our ocular surface patients are born to have accelerated aging because of the abnormal cytokines, inflammatory cascade related to the ocular surface disease that gets into and around the periorbital area and causes an accelerated aging process of the lashes. Medical conditions can cause this. We know thyroid problems can cause issues with the brows, psychiatric, if you have trichotillomania, autoimmune conditions, and also trauma. Okay, so even though we have relegated some of our aesthetics procedures to plastic surgeons, to dermatologists, in my role as a trainer for SmartGraft, I've really found that there are 3 specialties that are uniquely suited to hair transplantation, especially brows and eyelashes, and that is plastic surgeons, ENT, and ophthalmology, because of our mastery of fine motor skills. So better than ourselves to address the unique structure, function, and anatomy in and around the eye. And I wouldn't trust anyone who didn't have a strong history in microsurgery, anatomy of the eye knowledge, and a knowledge of dry eye disease to do any sort of lash transplantation. Certainly not people that are skilled at Brazilian butt lifts. Okay. Not only that, but we have a strong familiarity with technology. I think we are the most tech-heavy specialty that exists. I really regret that my patients aren't showing up here. Do they have no way to change the photos or bring the photos up? Maybe not. Okay, I'll ask you to use your imagination. In 2015, there was a peer-reviewed paper that showed us that there is an ideal length, density, and curvature to the eyelashes for ocular surface optimization. Not only that, but there is an optimal porosity to the lashes. Every one of these characteristics declines as we get older. And by get older, I mean as soon as we turn 27, it's all downhill from there. We know that there is an ideal length, not too short, not too long, to reduce the shear stress of the tear film on the ocular surface. And we know that healthy lashes do play many roles. Not only are they adding to the lubrication, but they also prevent particulate matter, and they act as antimicrobial factors. There is a loss of the curvature of the medial lower lid as we age. Everyone's eyes become rounder. We lose the very nice almond shape that we have. And so it may be, and I'll put to you, is lateral canthal pexy, or lateral tarsus strip, actually a treatment for dry eye disease? Possibly. When the eye becomes more round, we actually lose the curvature, the angle of the medial lower lashes, and restoring them may actually help us restore health to dry eye disease patients. Not only that, but if we restore the lashes to their natural function or the homeostasis, could we in fact modify the disease of dry eye? Okay. I have some really great pictures here of me doing eyebrow transplants and eyelashes. That was the easiest way that we got started with eyebrow transplants. Pamela Anderson was very popular in Baywatch in the 1990s, and everyone overplucked their eyelashes. Now again, in the late 30s, everyone loses their temporal brows. You can start to look at each other just to double check my work. But as we get older, and of course with genetics and certain medical conditions, we lose the eyebrow laterally. So microblading, very popular in the United States. How about here in Europe? Are people doing that? Kim Kardashian made it very famous. It never looks natural. It's just basically a tattooing process. It is infinitely more natural to bring natural hairs forward and place them in the area of the eyebrow where they are forever hair. So we do have an area of our scalp that's called forever hair. It is around our ears and back towards the back. My husband's not here as a demo. I hate to call him out like that, but that's the hair that he has left. And it is forever hair. It's not affected by age, sex, stress, or genetics. And so when we move the furniture, essentially what we're doing with hair transplants is moving that forever hair forward into places that are affected by those factors, and they remain forever hair wherever we place them, eyelashes, eyebrows, or in the front part of the eye. Okay, so very much like what we were talking about before with inflammation, we have topical medications, we have oral medications that can help us regrow the hair. Many of these are blood pressure medications and or prostate medications that have incidentally been found to help with hair growth. But in terms of the inflammation, we know that topical cyclosporin works for the regrowth of hair. So if you happen to have any Restasis or Sequa samples in your cabinet, please know that we've known since the 1960s that that will actually help to regrow hair because of the reduction of inflammation, and again, that inflammation concept. The JAK inhibitors, more recent information, can regrow hair even in alopecia areata universalis patients. So they can grow hair, people that have heads that look like dolphins, bowling balls, etc. We actually can regrow full heads of hair. We can use that topically, and we can use it orally. And then stop me if you've heard this one, red light therapy, photobiomodulation, PRP, also very helpful for retaining hair. Okay, this is a really nice picture of the follicles and the machine that I use, as well as me using it. SmartGraft is a new machine. It's basically the iPhone 16 of the hair transplant. We did a very special thing with the vacuum to help preserve the follicles. We put them in basically an organ transplant refrigerated unit, 0 to 4 Celsius, and we shower them with a growth liquid every 15 seconds to help us get basically a 97% transfer rate. It is minimally invasive. We do it in the office. We can do up to 3,000 grafts in one day. It is permanent, and we get very natural results, which you can see if I have any pictures there. What I would like to talk about now is some of the fun work I've been doing with Visidyne. We didn't get to talk about Visidyne during the retina session, but I will tell you that in 2022, Michael Longacre at Stanford maternal fetal medicine found that it inhibits the YAP protein. So yes-associated protein, the Engrailed-1 actually is responsible for the development of scars and the prevention of scarring in patients that had surgery. So what they noticed that when they were operating on babies within the womb, if they operated before a certain time of gestation, babies were born with actually no scars and all of their sweat glands, oil glands, and hair follicles intact. It did result in faster healing and improved skin texture. So now we do that with all of our hair transplant patients. When I inject that, we're regrowing about 40% of the hair. That's never been done before. It used to be that you could have a certain number of hair transplants until you were unable to harvest more. Now we can grow hair back where we harvested it. And this is a picture of one of my patients. You can see this on my Instagram, but we injected Verteporfin on one side. You can see a very dense growth on the side that we harvested and injected the Verteporfin there, and really very little growth on the other side. The last thing that we are doing with our machine is skin seeding. So I've taken the machine, and instead of taking hair follicles, we are removing atrophic scars, replacing them with natural skin growth from behind the ear, using Verteporfin at the same time to develop a way to revise scars. This is my information. I also have a picture of myself. You can't see that as well. I apologize for my lack of illustrations here. They were there when I put them there, so if you have any questions, I'd be happy to answer those.